Good morning, all of you. Good morning.
Good morning, sir.
Good morning, sir.
Good morning, sir.
Good morning. Now, today we would like to discuss about the dietary care or nutritional care at the pre-operative state. Pre-operative state. I have already distributed the study material. Okay, I upload the study material in our website. So you know that operation, surgical operation is a specific condition of trauma. So it is also a special type of traumatic state. And how we can able to minimize that traumatic stress which is developed due to surgical procedure, which are developed due to surgical operation. So we discuss about that dietary care at the post-operative state to minimize the traumatic stress of the patient. Okay. Now, this surgery may induce the physical stress on the patient, number one. It also minimize the body weight because catabolic reaction is also associated with the surgery. And number three, that is, it also results mental trauma on the patient. And third one, operation is also results some wounds, and thereby the wound healing is also associated with that operation. So to overcome the onset of physical stress due to surgical operation, to overcome the loss of body weight in connection with surgical operation, next one, to combat the mental trauma which is associated with the surgical operation, and fourth one, that wound healing process which is noted as post-operative state. To trigger this process, to trigger this wound healing process, to minimize the mental trauma, to minimize the mental stress, to minimize the physical stress, to overcome the loss of body weight, all these, the nutritional care at the pre-operative state is very much important. Okay. From research, it has been indicated that mortality and morbidity associated with the surgical operation, mortality and morbidity which are associated with surgical operation, are closely associated with the nutritional status at the pre-operative condition, at the pre-operative stage of the patient. So nutritional status of the patient is most important to minimize the complications which are developed at the post-operative state. Side by side, the mortality and morbidity due to surgical operation can be checked, can be minimized by that upgradation of the nutritional status. It has been indicated that mortality, morbidity are elevated, are increased significantly if the patient remain in undernourished condition at the preoperative state, undernourished condition. And thereby this dietary care is most crucial, most critical for the minimization of the complexity which are developed at the post-operative. This dietary care at the pre-operative state are generally adopted when the surgical operation is pre-planned for long ago, pre-planned. But when there is a sudden or immediate operation, when there is a immediate operation, when there is a need of immediate operation, in that case, the preoperative nutritional care is not adopted because sufficient time is not provided to the dietitian. But the number of such cases are very minimal. That the immediate operation, this number of immediate operation out of the total operation which are conducted in the surgical unit of any health sector is minimum. But in maximum, these are the pre-planned operation. So in most of the cases, the dietitians have the sufficient time for upgradation of the nutritional care. Another research study also indicated that out of the total patients admitted at the surgical ward for the operation, 25% patients are suffering from undernutrition. 25% patients are suffering from undernutrition. So these two studies, that is from the viewpoint of mortality and morbidity associated with the surgical operation, and the number of patients who are suffering from undernourished at the preoperative condition, that is about 25%, where the mortality and morbidity is also very high in case of postoperative condition. So from these two viewpoints, the necessity, the importance of the nutritional care or dietary care for successful operation is very much important. Okay, so nutritional or dietary care is very much important to minimize the complications. Now, next one, that why this nutritional care is most important. Number one is that 8 hours before the operation, 8 hours before the operation, the NBM, that means actually that nil by mouth. There is no food is provided 8 hours before the surgical operation, major surgical operation. So as the total food supply is checked, then the question will come how the patient will get the energy. And that energy is coming from the stored nutrient. And how the stored nutrient can be performed in the patient. And this is conducted by the pre-operative dietary care. So pre-operative dietary care can able to provide the sufficient stored nutrient in the body of the patient that can overcome the arrestation of the supply of nutrient 8 hours before the operation, which is known as the NBM. That is the nil by mouth. No food should be provided by mouth. Number one. Number two, that prophase at the postoperative state. You know that there are two phases at the postoperative complication, known as the F phase, the first phase, and the flow phase. And the flow phase, you know, that catabolic reactions are developed. Catabolic reactions are developed. That means energy expenditure is moved in this flow phase under the guidance of different hormones, cytokines, etc., etc. So if the nutrient stored in the body is not up to the level, then the building materials of our body would be catabolized. And due to such high catabolism of the building materials, the deterioration of the health status will be noted. That trigger the intensity of the stress, that trigger the intensity of the trauma, So by proper pre-operative nutritional care, we can able to supply the requisite amount of nutrients at the flow phase of the post-operative state, and thereby the different complications raised at the post-operative state can be minimized. Third one is that at the post-operative state, anorexia is also noted in most of the patients. Anorexia. That means tendency of the food intake is diminished, which is known as the anorexia. So if the food intake tendency is decreased and the body is remain in high catabolic state, so there is a double burden state. Double burden situation is developed in the body at the post-operative state. Double burden. What are these double burdens? Now, one burden is that the patient is suffering from anorexia. That means the tendency of the food intake is diminished. And side by side, under the guidance of
Catabolic
cortisol,
reactions.
under the guidance of cortisol, the catabolic reaction is enhanced. So if we take the proper dietary care at the pre-operative state, pre-operative, before operation, if we adopt the proper dietary care, we can able to supply this nutrient for high rate of catabolism. And side by side, the stored nutrient can able to supply this nutrient, and thereby the complexity due to the anorexia can be neutralized. So the double burden, anorexic condition and the high catabolic condition can be minimized by the proper nutritional care at the pre-operative stage. Another point or another importance of this pre-operative care is that hypovolemic shock, which is noted at the F phase at the post-operative. At the F phase, hypovolemic shock is also noted. Hypovolemic shock. Okay. This hypovolemic shock can be minimized by proper dietary care before operation. Because if we increase our plasma albumin level by proper supply of nutrient before operation, then this high plasma albumin can able to increase the osmotic pressure of the blood, and which has a high tendency to hold up maximum water in the blood, and thereby hypovolemic shock can be minimized, which is developed in the F phase. So the another importance of the preoperative nutrition care is that you can able to minimize the intensity of the hypovolemic shock, which is developed in the F phase of the trauma or at the postoperative stage. Okay. Next one is that edema is also sometimes associated with the operation, surgical operation. Edema. That's the accumulation of the body fluid in the tissues, in the peripheral tissue zone. That's the edema. And that edema formation can be minimized by the high level of plasma albumin by proper nutritional care at the pre-operative state. By proper nutritional care of the pre-operative state. So this is another importance of the dietary care at the pre-operative state. And last one, that is the importance of dietary care, that drug toxicity can be minimized at the post-operative state by proper dietary care at the pre-operative period. What is that drug toxicity? You know that drug is transported through blood in two forms. One is known as a bound form and another one is the free form.
Free form.
Okay. And this bound form is mainly in conjugation with the plasma albumin. So by proper dietary care before operation, if we increase the plasma albumin level, then the medicine which are applied at the post-operative, most of these nutrients are bound with the albumin, but in the bound form, and the requisite amount present in the free form. If the free form is elevated, then the toxicity will be noted. So if the dietary care is not provided properly at the pre-operative state, before operation, then the plasma albumin level would be low, and due to the low plasma albumin level, free level of the medicine, free level of the drug in the plasma would be high. And that may result in the toxicity of the drug at the post-operative state. So to minimize the probability of the drug toxicity at the post-operative state, the pre-operative nutritional care is very much important. Am I clear? So these are the points that focus the necessity, that focus the importance, impact of the dietary care of the patient at the pre-operative state. Okay? Now, how we can able to assess the nutritional status of the patient at the pre-operative state? One method for such assessment is known as Prognostic Nutritional Index, PNI. PNI, Prognostic Nutritional Index, PNI. So PNI is the most important method by which we can able to assess the nutritional care of that patient. Now, what are the different parameters? What are the different sensors? What are the different indicators that control the PNI? The number one indicator is known as plasma albumin level gram per DL. And generally it is 4.5 to 5.5 gram per DL. Okay, so plasma albumin level gram per DL is one of the sensor of PNI. Number one. Number two, triceps skin fold thickness in millimeter. Triceps skin fold thickness in millimeter is another sensor for PNI. Next one, serum transferrin level mg per DL. Transferrin, that is the microplasma protein responsible for transportation of iron. So plasma transferrin level mg per DL is another sensor for PNI. And another one, the DH, there is the delayed hypersensitivity. Delayed hypersensitivity. Okay. Delayed hypersensitivity reaction that indicate the body capacity to recall antigen. Body capacity to recall antigen. There is a delayed hypersensitivity reaction. And there is a formula for the assessment of PNI in percentage, for the assessment of PNI in percentage. I have already mentioned in my study material that PNI percentage is 158 minus within first bracket 16.6 into albumin gram per DL minus within bracket 0.78 into triceps skin fold thickness in millimeter minus then within bracket 0.20 into serum transferrin level mg per DL minus within bracket 5.8 into DH. That is the delayed hypersensitivity reaction value. On the basis of PNI percentage, we can able to assess the nutritional status. If the PNI percentage is less than 40, it indicates low life risk, low or no life risk due to surgical operation. If the PNI is less than 40%, then indicates that there is no life risk or there is less or there is very low life risk due to surgical operation. If the PNI percentage is more than 40 up to 49.99%, more than 40 up to 49.99%, it focuses the intermediate level of life risk. And if the PNI value is more than 50, if the PNI percentage value is more than 50, it reflects the high life risk. There is a life-threatening high life risk of the surgical operation. So, the life risk of the surgical operation can be assessed with the help of PNI percentage. That's the prognostic nutritional index. Okay? Now, if the body weight loss is more than 10%, more than 10% of the ideal body weight of that individual, then the complexity associated with the surgical operation is elevated. Next one, if the patient having BMI, then the body mass index less than 19, it also indicates the malnourished state and is also associated with the complication of the surgical operation. If the plasma albumin level is less than 4 grams per year, it again focuses that mortality or morbidity rate is also high in case of such operation. Okay. Now, next one, we like to focus that what are the guidelines of the pre-operative nutritional care? What are the guidelines? What are the guidelines for this pre-operative nutritional care? One is known as carbohydrate loading. Carbohydrate loading. That means before operation, the carbohydrate loading in the liver and the muscle should be increased so that at the NBM phase, there is a no nil by mouth phase before operation, 8 hours. And similarly, the anorexic phase just after operation. And third one, at the flow phase or high catabolic phase at the post-operative state. This high carbohydrate can able to provide the energy as per requirement of the patient. Now, how this carbohydrate loading is performed or this glycogen loading is performed? Now, this glycogen loading is performed generally started after 7 days before the operation. 7 days before the operation. Okay? For first 4 days out of 7 days, for first 4 days out of 7 days, the carbohydrate supply along the meal should be curtailed to some extent. You know that generally we provide 65% energy through carbohydrate. But 4 days, first 4 days of this 7 days prior to the operation, we provide low amount of carbohydrate so that it can able to supply 50 to 55% energy of the carbohydrate from carbohydrate. And the rest is coming from other non-carbohydrate sources. So due to low rate of carbohydrate supply for 4 days, the first 4 days out of 7 days prior to the operation, the liver and the muscle glycogen will be utilized and their level would be decreased. Am I clear? And at that condition, the different enzymes which are responsible for glycogen synthesis would be stimulated. And for that reason, for last 3 days out of 7 days of the post-operative period, last 3 days out of 7 days, first 4 days we supply minimum carbohydrate, that is 50% of the total energy supply. But for last 3 days, we provide excess amount of carbohydrate. Excess amount of carbohydrate. And that is about near about 75% of the total energy. Okay? Along with requisite amount of the carbohydrate and the protein and fat. And this excess carbohydrate supply, along with the high stimulatory condition of the glycogen enzymes or glycogenetic enzymes, the glycogen level, the glycogenesis or glycogen synthesis in the liver as well as the muscle would be elevated. Okay? Generally, the liver can able to store about general level that is 70 gram, and the muscle, total skeletal muscle can able to 400 gram of glycogen. But due to that procedure, we can able to increase the glycogen content in the liver and the muscle by more than 70% of the normal level. And this high level of the glycogen stored in the liver and the muscle can able to provide the excess glucose due to the stress and provide and supply the energy. It minimizes the protein breakdown. It minimizes the protein breakdown for energy supply. And thereby the body weight loss can be minimized. Side by side, muscle protein degradation would not be noted because the muscle protein degradation is also associated with the peripheral edema. Okay? Side by side, this excess glucose can able to synthesize the protein at that period that will help the synthesis of immunoglobulins, synthesis of different enzymes, hormones, etc., which are very much essential to combat, to challenge the post-operative state. So this glycogen loading is very much essential at the pre-operative condition. Okay. The second one, that is a protein supply. So protein supply is the most important process at the pre-operative state. Generally, we supply 1 gram protein per kilogram body weight per day. But at the pre-operative state, we supply about 1.25 to 1.5 gram per kilogram body weight. So near about 50% elevation, 25 to 50% elevation of the protein supply should be maintained. And that protein supply, high protein supply, is responsible for the prevention of post-operative edema, number 1. Number 2, it also prevents the drug toxicity by increasing the plasma albumin level, and thereby the free drug level in the plasma is remain within the desired range. Number 3, this high protein supply can able to potentize the immune status of the body, and thereby the sepsis related to surgical operation can be minimized. Sepsis related with operation or surgical operation can be minimized. Number 3, it can able to increase the enzyme synthesis, and thereby the flow phase, high catabolic reaction phase at the post-operative state can be maintained. So these 4 functions, and other one, the post-operative wound healing, can be performed by such high level of protein supply. So there are 5 important points why we supply excess amount of protein at the pre-operative stage. I repeat it. 1 is known as post-operative edema prevention. Number 2, drug toxicity prevention by increasing the plasma albumin. Third one is that potentize the immune status of the body so that sepsis related complications at the post-operative state can be minimized. Fourth one is that we can able to trigger the enzyme synthesis, and thereby the flow phase at the post-operative state can be maintained. And the 5th one is that post-operative wound healing can be performed by that high level of protein supply at the pre-operative state. The most important amino acids that should be provided through this protein supplementation, that is arginine, methionine, lysine, and proline, is the most important for wound healing. When that arginine, methionine, lysine, and proline. Now, next one, what is the fat at the pre-operative state? Polyunsaturated fatty acid, especially omega-3 fatty acid, should be supplied through the diet at the pre-operative state. At the pre-operative state, we have already mentioned the role of omega-3 fatty acid in case of sepsis, for the prevention of sepsis, for the prevention of trauma. We already mentioned in the class notes. These omega-3 fatty acids, which are very much essential because it can able to improve our immune status and thereby the post-surgical infection probability can be minimized by omega-3 fatty acid. It can able to diminish the stress-induced cell injuries, and thereby the wound healing would be triggered, and it also acting as anti-inflammatory agent. And thereby the inflammation related with surgical operation can be minimized. Okay, inflammation related with surgical operation can be minimized. Along with omega-3 fatty acid, the essential fatty acid like the linolenic acid, arachidonic acid should be supplied, which are essential for prostaglandin synthesis, PG. You know prostaglandin synthesis, which plays a major role to control the inflammation and to control the cellular metabolic reaction. Now next one, the vitamins. At the pre-operative state, the antioxidant vitamin should be provided. And out of these, vitamin A, vitamin E, which are fat-soluble vitamin that should be stored in the body. And these are known as antioxidants. And these antioxidant vitamins, mainly vitamin A, vitamin E, which are fat-soluble, remain stored in the body. That would be utilized to manage the stress induced by the surgical operation. So surgery-related stress induction can be minimized by such fat-soluble antioxidant vitamins like vitamin A and vitamin E that should be provided in the meal at the pre-operative condition. Vitamin A also stimulates our immune status. It also increases the number of macrophages and monocytes. Vitamin A also increases the chemotactic index of the macrophages as well as the monocytes. Chemotactic index, phagocytic index of macrophages and monocytes. And thereby, cell-mediated immunity is also enhanced by the vitamin A. Vitamin A is also helpful for wound healing, which is very much essential for post-operative state. So, before operation, the dietary care should be focused from the viewpoint of antioxidant vitamins, especially the vitamin E and vitamin A. Next one, what are the minerals that should be supplemented through diet at the pre-operative state? Out of the minerals, the 4 minerals are very much important. 4 minerals. One is iron, another is calcium, third one is magnesium, and fourth one is zinc. All are also required, but these 4 are most important minerals, which are very much needed for the post-surgical state or recovery of the post-surgical state. Iron is increase the hemoglobin level. And you know that hemoglobin is very much essential for oxygen supply. That also increase our energy output, etc., etc. And thereby the flow phase of the post-surgery, that the high catabolic phase can be maintained by high level of hemoglobin. And that should be maintained by iron. Similarly, calcium and magnesium, that the metabolic stress which is associated with the surgical operation can be challenged by such calcium and magnesium. Because both the calcium and magnesium are most important cofactors of several metabolic enzymes. Like magnesium is the most important enzyme for glycolysis. Most of the enzymes like hexokinase, phosphorokinase, where the magnesium is cofactor of this enzyme activity. So metabolic stress can be overcome by calcium and magnesium. Otherwise, the zinc. Now, zinc is most important mineral and which has dual role in this surgical, post-surgical state. Number one, that it is also the activator of different antioxidant enzymes like catalase, peroxidase, or the zinc acts as a cofactor. And thereby, thus, stress induced by operation can be overcome by this antioxidant activity of this enzyme, by the activity of this antioxidant enzymes. And the activity is controlled by the zinc, number one. And number two is that insulin sensitivity is enhanced by zinc. So zinc also most important for increasing the insulin sensitivity. And due to enhancement of the insulin sensitivity, the glucose utilization in the cell will be high. And due to such glucose utilization, energy supply will be more. And thereby we can able to challenge the flow phase. We can able to provide the energy for protein synthesis, because you know for wound healing protein synthesis is very much essential, and for incorporation of the single, for inclusion of single amino acid in the protein chain, 4 high energy phosphate bonds are required. 4 high energy phosphate bonds are required. So by such glucose oxidation, by increasing the insulin sensitivity to zinc, we can able to supply energy of the cell as per requirement, as per their essentiality at the post-operative state. So these are all about the involvement of the different dietary ingredients at the pre-operative state, especially the carbohydrate, protein, fat, vitamins, especially vitamin A and vitamin E, and then 4 minerals like iron, calcium, magnesium, and zinc. Okay, so this is all about pre-operative nutritional care to minimize the complexity raised due to surgical operation, and thereby the morbidity and mortality associated with the surgical operation can be minimized, and the success rate can be increased maximally. So this is all about the pre-operative nutritional care. Have you any question? You may ask. Less than 1 minute is more. Less than 1 minute. Have you any question? Be quick.
Sir, PNI calculation ta sunte paini.
PNI, I have already mentioned that formula in my study material. Okay, PNI percentage, that is 158 minus within bracket 16.6 into albumin level gram per dl, minus within bracket 0.78 into tricep skin fold thickness in millimeter, minus